This episode is sponsored by Better Vet, mobile veterinary care for happier pets. From wellness visits to surgery, Better Vet has you and your pet covered in locations across the U.S. In fact, Better Vet is excited to announce that they are now serving pets and pet parents in the Los Angeles area, and to celebrate, they are offering $50 off on your first home visit exclusively for Top Dog Tips listeners. When you register for your new account, use promo code TOPDOGTIPS to fetch this offer. Take care.
Welcome to Theory of Pets. I'm a passionate pet owner with a drive to help others like me uncover the truth about the pet industry and what goes on behind the scenes.
Hi there, everyone. Welcome to the Top Dog Tips YouTube channel. Thanks for joining us today. This is also the center for the Top Dog Tips podcast. Today, we're going to be talking about dental hygiene and dental health for dogs. Today, I will be having Dr. Lyndsey Kingsley on today. I'm going to be asking her a range of questions. As you all may know, it's kind of a pain to brush your dog's teeth, especially if they're one that's not really enjoying the process of getting their teeth brushed or liking things sticked in their mouth. I know for a fact when I first started brushing my dog's teeth, she definitely didn't like it. Fortunately, as time goes on, with patience, I have been able to get her to enjoy the process with maybe some chicken-flavored toothpaste. But this conversation today is going to be really interesting because we're going to talk about everything having to do with dental health, why it's important, how dental health actually affects the dog's health overall, and their longevity and how long they live. I'm also going to be talking to Dr. Kingsley also about the cost of dental health hygiene when there are scenarios that, dental health takes a turn and starts to decline rapidly, just because a pet parent doesn't like brushing their dog's teeth, or the dental cleaning is too expensive and they put it off to the very last minute. And we're also going to be talking about what you can do to prevent dental diseases. So stay tuned today. It's going to be a great podcast, and thanks for listening. All right, thanks for joining me again, Dr. Kingsley. I'm really excited about today's talk with dental hygiene.
Yeah, me too. This is a good one. Something I have a personal interest in, so get into it.
Yeah, me too, especially as a dog owner who trying to brush my dog's teeth is not like my favorite experience. But I finally have gotten it down to where she tolerates me sticking a toothbrush in her mouth.
Hey, it's Rome wasn't built in a day. It takes some time to really get them used to a good dental hygiene routine. So
yeah, well, why don't we start off with that theme? So let's talk about how important dental hygiene is for dogs. So why don't you tell our listeners how important it is and how it can affect just about everything having to do with the dog as far as their health?
yeah, so I think the reason why so many vets just have dental hygiene on blast right now is it's been under the radar for so long and I mean, really, you hear people all the time, oh, I've had dogs for 30 years and I've never had to clean their teeth. And it's like, well, women who were pregnant used to, chase their smoke down with a cocktail. So, we learn and we get better and we're dynamic as a species. So same thing holds true to veterinary medicine.
Mm-hmm.
It's just as important in dogs and cats as it is in people.
And, can it actually turn into something life-threatening for dogs, or is it normally more of a mild scenario towards the end of their life if a dog doesn't get their teeth brushed?
Well, if everything goes according to plan, we really try and push prevention. It just with so many other things in medicine, an ounce of prevention is a pound of cure. So we hope for most of the animal's life, it is just, mild housekeeping and maintenance. But sometimes in animals, and especially dogs and cats that are genetically predisposed to having dental issues, it can become, not necessarily a life threatening. Like it's not something that we diagnose and the animal's going to die, in a month, like some sort of very malignant tumor. But I think so much of it is sight unseen by an owner. It's more than just, oh yeah, I have stinky breath. We're talking about
Hmm.
huge pockets of infection, nerves that are constantly being um, jiggled and moved, and so it causes chronic pain in these animals.
Hmm.
There's a condition known as bacteremia, where bacteria, and a very specific bacteria that likes to live in the mouth, can enter the bloodstream and actually affect other organs. So if we have an older dog or an older cat that maybe has some subclinical kidney issues or liver issues, tissue that's just not 100% healthy, it's a little more predisposed to potentially housing that bacteria. We can have some microscopic change. So it may not necessarily be immediately and tragically life-threatening, but it can certainly shorten the lifespan of your pet and potentially affect their quality of life.
Hmm. That's so. Why don't we talk a little bit about those different bacterias? The only one I'm aware of is periodontal disease. What other forms of, I guess, dental disease are there?
Yeah, so periodontal disease, that's really, I mean, that's the buzzword, right? Like
Mm-hmm.
that's if you take your dog into a vet and they say, hey, they have stage 1 through 4 periodontal disease, that's a big blanket statement. Peri is kind of the Latin term for around, or near, and then dental, tooth, dental. So periodontal disease means just disease around the tooth. So that can usually looks like bacteria finding their way underneath the gum line and causing damage to the ligament, just like, your bones are held together with a ligament. Your teeth are actually held into your jaw by a ligament. And it's a really, really tough ligament. Have someone that, makes a living by extracting teeth. There's a reason the term "it was like pulling teeth" is a thing.
Mm-hmm.
So bacteria can get under the gum line, damage that ligament, and actually start damaging the bone around the tooth.
Mm-hmm.
And just like, how I kind of put it into perspective is just like we see infections in your skin, if you have an eye infection, if you have, anything that causes pain and swelling, there's usually pus associated with it. We see that in the mouth, but
Mm-hmm.
not too many people are wrenching their dog's mouths open and can see, all aspects of their teeth. So,
Right.
so that's probably the number one thing that we see in dogs, is usually just damage to the bone and infection and that sort of thing. In cats, we can also have things like resorptive lesions that is where the immune system actually identifies the tooth as foreign and starts breaking down
Mm.
into the enamel and into the tooth itself.
Wow.
Dogs can also get those, and people can as well. And that's a little bit more, I mean, again, it all kind of starts off with bacteria and inflammation, but that's a little bit more immune mediated than just the blatant, I haven't taken care of my dog's teeth, or maybe, I have a tiny dog that has way too many teeth in its head, and it just has all these pockets where food gets stuck, and, it's just a recipe for periodontal disease.
Hmm. Yeah, we recently, a couple months back, my girlfriend and I had to put her dog down.
Oh
Unfortunately,
no.
yeah, Chase. He was a
Oh,
dachshund. He was about 16 years old, coming up, I think, on
yeah.
17 years old. I've mentioned him in the podcast before, but he did have periodontal disease, but he was just so to the point. He was old, and he had a inflammatory respiratory disease where he just kind of
Oh,
constant cough. I
yeah.
think that's what it's called.
Mm-hmm.
Um, and so he was fighting that. He was on antibiotics and stuff like that, and they diagnosed him with periodontal disease. And they said, in this scenario, if, at least from what Google tells me, is it can get definitely very severe and affect, like other organ failure. But
Mm-hmm.
the disease will, if you don't take care of your dog's teeth, or if you don't have them at that point extracted, um, the infection will, because he's too old to fight it, is that
Right.
it'll just slowly lead to like where I guess there's a the infection will slowly like there's a part
Like
between the brain and the mouth, like
hmm
that cavity will just continue to wear away, and then he'll just basically hemorrhage from his nose. I know that's pretty
Yeah.
gruesome, but um, as far as I think that's my only experience with periodontal disease.
Yeah, and unfortunately, dachshunds are one of the poster children, and I think what they were describing is a condition known as an oronasal fistula, which is it's usually associated when we have disease in the canines or the two big teeth up front.
Hmm.
There's not a lot of real estate between the top of that tooth and the nasal cavity,
Hmm.
and I'd say the majority of the time this happens, when you extract that tooth, it will actually open up a little hole right there. But taking away the infection and cleaning everything up, it will eventually heal. And then, we don't just have that infection now bridging between the mouth and the respiratory tract. But,
Hmm.
and those are really tough scenarios, and we get them a lot. Age is not a disease, but we certainly prioritize what is the most life-threatening, what is the most important thing for this animal to have a great quality of life. And if we miss the boat on managing their teeth and they have a heart condition that can't tolerate anesthesia, or if they have something else that could potentially be potentiated by anesthesia, we certainly take all of that into account. But again, there's a lot of time between when the dog is young and when they're old, and managing that condition, will help try and mitigate some of those really tough calls later on down the line.
Yeah, it came to a point to where we could not afford she my girlfriend, she could not afford the procedure.
Yeah.
um I think it was going to be a few $1,000s, but so it was, he lived a really long life.
No kidding. That's 17 years. Holy cow. He was
Yeah.
old enough to drive not too far from buying a drink. Poor little guy.
Yeah. Yeah, so it was sad, but
Yeah.
so why, like, let's talk about why dogs' teeth are becoming full of plaque and tartar now versus it just doesn't seem like it was something that happened before we domesticated dogs. I don't know if that's because of their diet, or maybe it just did happen and it's just, but or dogs in the wild just didn't live a long enough life.
Yeah, no, I mean, that's a really good question. And I think there's several factors to it. I mean, one, um, wild dogs, they are subject to true natural selection. So,
Hmm.
if it doesn't work, nature's going to weed it out. And a wolf that has a giant tooth root abscess at the root of one of its canines, it's probably not going to be able to hunt as well as some of its pack members. It may not be able to eat as well, and that animal is probably not going to last too long.
Hmm.
And to put it into perspective, so I spent a little bit of time in zoo medicine out of school, and so we would do dental cases on animals that are wild. And we still saw periodontal disease, and these animals that lived in very sheltered environments where they were living, to 13, 14 years old. We did see periodontal disease, and we
Hmm.
certainly were not brushing these animals' teeth. I can assure you that. But they would still get plaque, they would still get tartar, but the architecture of their mouths are very, very different. They
Mm.
have usually we don't see very frequently them having extra teeth or overcrowding. The shearing and occlusal kind of space and area on the sides of the teeth are optimum. So,
Hmm.
their diets usually consist of eating whole prey. So they're crunching on bones, they're crushing, ripping sinew and that sort of thing,
Hmm.
which can certainly help mechanically break down some of that tartar. They're also not getting, excess carbohydrates or these little
Mm.
crunchy treats that we give our pets that look, have this cute little coating on it. Um, So, I think between genetics and diet and lifespan,
Mm-hmm.
that's why we're seeing them. And when we're breeding dogs, domesticated species, they certainly have not been subject to natural selection. It's very unnatural selection.
Right.
So, if we're looking at a Yorkshire Terrier and we say we want to get this thing as small as we can because that's what people want, the number of teeth is not necessarily decreasing.
Mm-hmm.
And some of the things that we see in these very dogs with very narrow family trees
Mm-hmm.
is extra teeth, overcrowding. They don't
Mm-hmm.
have that optimal occlusal space. Most of the time, they're eating wet food or very teeny tiny little kibbles that are easy for them to chew and digest. And so, again, it's just a recipe for dental disaster.
Wow. So I have two things I want to touch on. So one, my dog is a mix. I feel like she might have some bulldog or either that. She looks like German Shorthair Pointer,
Hmm.
which they also are also prone to having like an underbite as well. So
Hmm.
you can see her teeth, like she's like this, like all the time. So she's so I wanted to ask you, now does is that because of how her jaw is structured or how the teeth grew? Like the teeth, did they grow like more outward to where like the bottom jaw? Does that have to do with dental, or is that just kind of how? Like, what do you think?
It can be either or. Usually, if it's a true, I mean, some of the underbites where, I mean, it looks like a bird could come and land, on their lower teeth. That's certainly more of like a skeletal
Mm-hmm.
structure. Um, and I mean, we see it in people too, right? So, braces in the US is a really common thing for teenagers to have. And
Mm-hmm.
I think most people think it's just a cosmetic thing, but it really does make the your overall dental health so much better,
Mm.
I think everybody would agree that they're probably not the best at flossing. And that's, but again, we don't necessarily get these horrible nasty infections even if we don't,
Mm-hmm.
because our teeth are straight.
Yep.
Mechanically things are aligning where they should be. But I don't know too many people who would put in a retainer and try and readjust their dog's bite. Most of the time, it's just very endearing. So, but yeah, so it certainly can lead to some almost inevitable dental issues down the line.
Mm. So, give me an example of like what kind of well, just what are they more prone to tooth decay and like tartar and plaque dogs with like an underbite or what a underbite? That's what my dog
Yeah,
has.
yeah. So what we can see is essentially the lower incisors or the little piano keys, so to
Mm-hmm.
speak, they're meant to slide right behind the upper incisors, the upper,
Right.
uh, you know, and that's how nature intended.
Yep.
If we have an underbite, what typically happens is the upper incisors now, instead of the pressure going just sliding right along that surface, that pressure is going directly down onto the roots of those little teeth. So
Mm.
over time, we'll see damage to the roots. We'll usually see some gum recession there. And eventually, as the bone starts to wear away, we'll start seeing mobility in those guys. So, a lot of times those will need to be extracted, and they're fairly, they're not too difficult. And usually once we get mobility in the teeth, it's not necessarily like losing baby teeth that are
Mm-hmm.
designed to fall out. With teeth that are infected and mobile and damaged, those are usually causing the patient some discomfort.
That's so you've piqued my interest on this just because I'm like, well, am I gonna have to have her teeth removed? But what I do feed her is homemade dog food, and it's
Hmm.
well, I'm not the one that makes it. There's a lady who lives locally, and she's actually been on the podcast, but she's so it's wet food, so it's just like chicken or beef and like whatever else she puts in it.
Hmm.
Um, Now, because Belle isn't chewing like hard like food that she has to crush, or would you say that she's probably safer from having the I guess nerves damage of those what you said the front teeth in between the canines at the
Hmm.
bottom.
I mean, I think, maybe it could potentially slow things down. I mean, the
Mm-hmm.
incisors themselves, they're kind of the slackers of the teeth that
Mm-hmm.
dogs have. They're really meant for, in the wild, they'd be meant for, biting down and helping shear things off. But when they're
Yep.
just eating regular kibble, they really don't do a whole lot of work. But
Mm-hmm.
even with just normal jaw movement, depending on how her back teeth align. Now, if she's has a gap in her upper teeth aren't necessarily bringing down a ton of force on the lower, then that might not be as much of an issue.
Mm-hmm.
But certainly those areas that aren't making contact with the other teeth, we will see develop tartar. So really focusing on those areas when you're
Mm.
as well as you can brush your teeth.
Good to know.
Yeah.
Good to know. Okay, I'm sure there's other people who have bulldogs that are listening as well, or other dogs that have this underbite. And is it pretty much the same case as an overbite too?
Yep, pretty much anytime we don't, in a lot of, so bulldogs and brachycephalic or kind of the snub-nosed breeds,
Mm-hmm.
a lot of times what we'll see is instead of their teeth being kind of right in line with each other all the way down, they'll
Mm-hmm.
start to rotate one way or the other. And so
Mm.
we'll have kind of these weird little gaps and spaces. And then when they close their mouths, instead of, the surfaces that are meant to handle the pressure and meant to handle the actual mechanics of chewing,
Mm-hmm.
uh, they're all wonky and kind of all over the place. And so
Mm.
things that are built to handle pressure are not, and then things that are a little bit more delicate are having more pressure. So we tend to see a lot more wear prematurely in those types of breeds.
Got it. Okay.
Mhm.
Okay, well, sorry for going down that little tangent. I was just curious because now I'm like, oh, now my dog is at risk.
Oh no,
Yeah,
nobody's safe.
yeah.
Um,
All right, so you touched on this. The other thing I wanted to touch on, you talked about diet, and you're saying that carbohydrates, from what it sounds like, I guess because it's I don't know if it's because it's like there's sugar in it or something having to do with the starch or what have you. Is that why you're saying the increase in carbohydrate is what's causing increase in tartar and plaque in dogs' teeth? Is that basically what you're saying?
well, when I say carbohydrates, I specifically mean sugars and
Mm-hmm.
and that sort of thing. So same thing, I mean, tale as old as time. You go to the dentist and when you have a little kid, you're like, you're gonna get cavities if you eat
Mm-hmm.
candy, and it's true, right? Like sugars like to feed bacteria. One of the medical conditions that we can see actually make periodontal disease much worse is diabetes, which is a
Mm-hmm.
condition where there's an abnormally high amount of sugar in the blood and circulating around the body, and that can make infections much, much worse.
Mm-hmm.
So same thing, we're the teeth in the mouth, that's kind of the first point of the whole system.
Mm-hmm.
And what goes in can potentially feed the normal flora that we have else in our body. So fortunately, dogs aren't like us and don't have a habit of drinking soda and, for me, Red Bull and, coffee and
Mm-hmm.
wine and things that have, pH that damage the enamel over time. But there's still some component to diet, namely the ingredients and potentially how much sugar it has, as well as the texture. If it's crunchy, it's going to help break down a little bit more of the plaque and tartar,
Mm-hmm.
versus if it's just purely soft, there's not a whole lot to help break any of that away. So,
Got it. Okay. Well,
mhm.
now let's start to dive into giving some value to our listeners. So, how often should you brush a dog's teeth, and or have their teeth brushed if you can't brush them yourself?
Yeah. So, I mean, the way I explain it is, and again, it's slightly different because again, we have diets as humans. that are a little bit harder on our teeth than dogs do. But all the same, if I don't brush my teeth twice a day,
Hmm.
you can tell. You notice a
Yeah.
difference. There's that nasty film. You start to get a little bit funky breath. And so
Yeah.
on that same note, if you can brush your dog's teeth twice a day, go for it. And I have a
Hmm.
lot of people that look at me like I have three eyes when I say that, but we live in a culture where people are swapping, children for pets.
Yeah.
And
All right. Sorry about that. A little bit of technical difficulties there. But you were just talking about um, how often pet parents should brush their dog's teeth. You were saying about twice a day. If you can do that, great. And then you were also talking about how, um, in today's world, we're seeing pet parents um, basically swap out kids instead of swapping out kids for dogs because they just don't want kids yet. So um, we'll just I'll just let you kind of finish that thought, and then we'll keep rolling here.
Yeah, yeah. So, um, I know when I tell owners, they ask me that question, well, how often should I brush my dog's teeth? Well, if your dog tolerates it up to twice a day, just like we do as people, that's what my dentist tells me we should do. But I tell some clients that, and they look at me like a deer in the headlights, like, you've got to be absolutely crazy, lady, that I'm going to be brushing my dog's teeth twice a day. But my job is to offer the best options available. And so many people nowadays are, like you said, replacing their, not having children until later in life, and their pets have become their children. So, me telling somebody that they need to brush their dog's teeth twice a day, and that's their kid, that's like, aye, Captain, we got it. We're on it. We will do it. But at the end of the day, whatever you can do, it's certainly more is better.
I wanted to ask you too because I try to brush my dog's teeth. I don't know how well of a job I'm doing. Do you have any products, or do you have any recommendations as far as how to brush their teeth to actually effectively slow down plaque and tartar? I guess because if they're from what it sounds like you're saying they're very similar to humans' teeth now, given their diet and carbohydrates. And so they're going to build it up no matter what. You're just trying to slow it down in between teeth cleanings, basically, and try and span out teeth cleanings. Because either way, I'm going to go get a teeth cleaning no matter how many times I brush my teeth in a day.
Exactly. That's a great point. So, as far as products, what the best ones are to use to brush, there's a company called Pet Smile that makes really great products that actually has an enzymatic cleaner, I should say, process in it that will help both break down and prevent, bacteria and plaque from forming.
Mm-hmm.
It also comes in very amenable flavors for dogs, so they usually like the flavor of it. They have some different styles of toothbrush that are more specific for the anatomy and architecture of a dog's mouth. Um, the other thing to note, and just like you said, I love that point, that even if you're brushing your dog's teeth twice a day, doesn't mean that they're never going to need a sedated dental cleaning in their life. It some dogs are lucky and they've been genetically blessed with very straight, evenly spaced teeth. Other dogs, not so much. And, I have a lot of gung ho owners who are all about brushing their dog's teeth. I've yet to meet anybody who is really gung ho about flossing their dog's teeth.
Good
So
luck with that.
just right. So, there's still areas, even though we're brushing well, that we can't get to. And that's where we need to go in and do things under sedation. Other products that can also help, because brushing your dog's teeth, we're really just hitting 50% of the surface area, right?
Mm-hmm.
Unless you have a dog that's just like a trained circus performer that will sit there and have his mouth open and you can get the inside. We're really just getting, the areas we can reach on the what we call the buccal side or the cheek side.
Mm-hmm.
So other things, it's a prescription diet made by Hills called TD. So you'll need to talk to your veterinarian to to get the hookup on this, but it's a diet that I recommend feeding on a treat basis. It's great for dogs and cats. There's 2 different formulations, but it's a little bit larger kibble that has little silicates in it that will actually mechanically break down and actually get all sides of the tooth. So it doesn't replace teeth brushing, but just with anything else, it's usually more effective if we hit it from multiple angles. So those 2 things are kind of my favorite go-tos that are both safe and don't add a lot of calories to a diet. Sometimes greenies are effective. They add a little bit of calories. So if we have a dog where we're working on weight loss, maybe that's not the best option. The TD treats might be a little bit better, and certainly brushing is going to be best for those patients.
So we do have, and just to be fair, we do have pet owners that are not necessarily very extremely trusting of hill science. So like, is there any other maybe single ingredient or some kind of other, what would we call it, homeopathic, natural, no chemical product that would actually do the same job for those who don't really feel comfortable if you say the word greenies, or if you say the word hill science?
If that is the case, I would just stick to teeth brushing. I can't really think of any super, there's different, rawhide treats, but those run the risk of, if you have a dog that's really excited about chewing, can swallow large pieces and it can become an obstructive foreign body, or in some instances can cause slab fractures of the teeth. So those are, I would say, sometimes more of a risk than even, if people are wary of different chemicals and byproducts and all that good stuff. There's not one really great homeopathic thing. There's some different water additives, which I'm personally not a huge fan of, because it can sometimes make the pet drink a little less water. In cats,
I could see that
can be really detrimental. So if you're leery of the other things, then just stick with this tried and true teeth brushing, and then with annual wellness exams, have your doctor really have a good look at their teeth, score their dental tartar and dental health, and help guide you on where we need to focus, if we do need to do a dental cleaning, or if there is a suspicious area that looks like it might be a periodontal pocket or infection, or something that we need to address with a little bit more than just brushing. Other thing to note with brushing is, if your dog does have severe dental disease, if your vet has told you that your dog has severe dental disease, we do not recommend brushing their teeth. At that point, it's really not doing any benefit, and it's actually painful for the pet. There's areas of the teeth that are exposed that are very sensitive. There's usually a lot of mobility to the teeth. So all we're really doing is creating pain, kind of moving bacteria around, and not really getting anywhere. So
got it. And
there is a caveat.
I was gonna say, while you were talking, one thing did come to mind. I don't really know if it's really recommended for teeth cleaning, but it is like a little chewing bone that dogs can chew on. The only thing is, I've heard, is that it can be dangerous if it splinters, is a yak bone. Those take forever for them to chew it down, and usually it slowly melts, but if the dog starts to get down to thinner areas and starts to crack and fracture or splinter off some pieces, it can be pretty dangerous. But I've used it with my dog, but now I'm a little more leery. Maybe I'll let him go buck wild when the yak bone's big. But as it gets as it gets smaller, I start to get, I'm like, ooh, I maybe should just throw it out.
Yeah, that's definitely more of a case-by-case basis. It's not something that I widespread recommend to my clients for a couple of reasons. So a lot of times there's often a coating that's really high in fat on those fresh bones.
Okay.
And we've certainly seen things like pancreatitis and gastroenteritis secondary to that. We have seen, as you mentioned, the splintering, so it can cause issues with their GI tract if those
Mm-hmm.
splinters get down tracked, or
Or
actually
fatal.
puncture,
Yeah.
or fatal, or actually puncture, the soft palate, or, the soft part underneath the tongue. We can have splinters there, which can cause a big issue. I had a puppy where it was wedged between one of the teeth.
Oof.
And it actually caused long-term damage. It was fortunately his baby teeth that were affected, but it affected how his adult teeth came in. So he now has this really odd gap that is kind of a food trap for him. But and then the last thing, if they do get it down and don't have any issues to a point where they're like, okay, well, we're almost there, I'm just going to swallow it. And then we have a foreign body that we have to go in and surgically remove if it decides it's not going to move any further. So not saying that, some dogs can't handle it, but there's certainly a myriad of potential issues with that when we have a lot of other things that we can use that are much, much safer.
Got it. Okay. All right. So I've heard, and you can confirm this, I've heard that dental hygiene also affects everything downstream. My girlfriend, she's a big proponent of like brushing your teeth and flossing because she believes that it can cause it can make you more sick. It can cause stomach problems. Like a lot of digestive issues are having to do with like dental hygiene. Is that would you say that's the same for dogs as well?
I'd say that the studies haven't been done. We don't have anything in stone or really compulsive evidence and case studies that have been done, but extrapolating from human medicine, it would not surprise me. I mean, the mouth is kind of the entry point of the rest of the body. We know that the bacteria in the mouth can enter the bloodstream, cause bacteremia, and cause microscopic damage in organs like the kidneys, the lungs, the liver, and the heart. That's one big thing you may have seen if you go to your own dentist, if you're filling out the history form. One of the questions is, have you ever been recommended or prescribed antibiotics before a dental cleaning? And that's very common in people with subclinical or clinical heart disease. If there's anything wrong, like with the valves of the heart that are not completely making a perfect seal, if there's a little bit of damaged tissue, then that bacteria from the mouth can actually transplant to those damaged valves and make a heart condition that's subclinical, meaning it's not causing any issues, can actually make it much, much worse. Condition known as bacterial endocarditis, very common with mitral valve. So we see that both in people and we see it in patients. It's a very small percentage of, I don't want everybody to take away like, oh my God, what if I'm never going to get my teeth cleaned again? This is horrifying. It's a very, very small percentage. But that just goes to show you that, yes, the bacteria that we leave just to, not take over everything can cause issues down the line.
That's super sketchy. I've never heard of that. That's insane to me. Good to know. So it makes me want to make sure that I always brush my teeth every single day, morning and night, maybe even a third time. But okay, so now let's talk a little bit about what can happen with dogs if they don't get their teeth brushed. And like we've already talked about some of the diseases, but let's touch on like periodontal disease. I think I talked about earlier that my girlfriend's dog, who's passed, had periodontal disease, and it was just to a point to where it was no return. And he had other problems too, but it was basically deciding whether or not to deal with this now, and where we had to put him down where he was suffering less, versus later on where he would for sure be suffering much more, and then put him down to where what that level. Anyways, periodontal disease. How bad can it get in dogs?
It can get pretty bad. I mean, I love doing dental cleanings and dental procedures. It's one of my little personal interests. And I mean, we have small breed older dogs are the poster child for disgusting mouths. We call them
Mm-hmm.
sewer mouths. So, I mean, we'll
Yep.
be in, and
You
every
smell
single
for sure.
tooth is, oh, yeah, I know. And every single tooth is loose. You know, the gums are recessed. They're angry and red. There's, I know this is a really gross graphic visual, but for those Dr. Pimple Popper fans out there, you know, there would be just pus oozing out from around the teeth. And literally by the time we were done, got everything out that needed to be out, got everything clean that needed to be cleaned, you know, took essentially resected all of the diseased and damaged tissue and then closed all the healthy stuff back together. I mean, I work in a mobile unit, so it's like a RV, so somewhat of a small space, but it was the same thing when I worked in a big hospital. The smell, you would smell it for the rest of the day, and you that's when you could really grasp just how severe some of these conditions were, is by this one tiny little mouth being able to have a stench that would permeate your clothes, that would make the entire space smell,
For the
and just
entire
know
day. Unless
for
you
the
washed
entire
it.
day.
Unless you wash your clothes.
Exactly. Right. So that's just to kind of put it into perspective. That was just what was brewing under the surface. And you know, it's so funny. We have these dogs that have these mouths, and it's just a process that goes, it progresses for so long, and then we finally fix the problem. And once, you know, they get over the effects of anesthesia, and, you know, the healing process happens within a couple of days, you know, some of the feedback is just so gratifying. You know, we have owners that like, oh my God, he's acting like a puppy again. And, you know, he seems so much happier, and he has so much more energy, and, you know, he wants to be scratched on his face again. And you know, it just goes to show that these guys can really handle a lot of discomfort, and just, you know, having that amount of bacteria in the body, it makes the immune system just constantly going.
Yeah.
You know, it's, again,
So it's
like we
stressing the
touched on.
body.
It is. And so, like we touched on, you know, periodontal disease is not, you know, like a late stage lung cancer, or you know, a ruptured splenic tumor, or something that is going to be immediately fatal. But it does substantially affect the quality of life for that pet if it's severe, whether or not we really notice it. And it can decrease their lifespan long term.
Wow.
Now, all of that being said, we certainly do prioritize other concurrent issues that an animal may have.
That
And
are
some
more acute.
patients that are more acute, or that could be, you know, that could be more immediately fatal, than periodontal disease. So if we have a dog that has a very severe heart condition, or a neurologic condition, or something that it may not be able to handle the anesthesia, then unfortunately we're sometimes left with just managing that pet's periodontal disease with different medications and pain medications, and a shift in their diet and that sort of thing. So if we can go for it, we always do try and fix it. But I, like you said, with your girlfriend's dog, I know he had a lot of other things going on, so it may not have been in his best interest to go in and get everything cleaned out and possibly blow the lid off of one of the other conditions. And okay, cool, maybe he recovers from anesthesia, but then that other issue is now much, much worse than it was.
Well, you know, the vet didn't feel comfortable sedating him. He was 16, so that's for sure. So it was like, and on top of that, me and her, and mainly her, she could not afford the procedure, which is really sad. Right. So you know, the whole point of this episode is just to talk about like how periodontal disease and dental hygiene, how important it is, and it's something that's not over. It's totally like just kind of, I guess, brushed under the rug, looked over, just glazed over. You're like, yeah, I don't know, I don't really feel like it, and then it gets to this point, and it's so preventable. and then it can become a procedure that is so like it's just you're met with what is it the two walls caving in. It's too expensive, your dog's too old, but if he doesn't get it, he'll probably die. So it's one of those, like, that's why I wanted to have this episode, because of how important it is for dental hygiene to be really taken seriously. It's not something that, should be totally brushed under the rug, as they say.
Right. Yeah. Yep.
What would you say the typical cost? I mean, you're a vet. What would you say the typical cost is for just teeth removal and sedation and that kind of stuff versus just going out and get a freaking toothbrush and like
and doing the dang thing.
And show a little discipline. And
Yep.
prevent this severe tragedy from happening to your dog.
Yeah. So it's not cheap. You're absolutely right. I mean, if we are just going in and cleaning the teeth and taking x-rays and just doing some housekeeping, that's a somewhat reasonable cost. And if you're really doing a good job brushing in between, it's completely variable by pet. There are some dogs that I have a corgi who has malocclusion. She's got a little bit of an overbite, and she does have a little bit of crowding. So she needs a teeth cleaning probably every 9 to 11 months. And then I have dogs that only need teeth cleanings once every 3 to 4 years because their owners are, their dog was just genetically blessed with having straight, well-spaced teeth, and they're very good at brushing their teeth. So the teeth cleaning itself, you're looking at a couple $100 for that procedure. Once we get to a point where we do have to start doing extractions, pain medication to go with the extractions, additional anesthesia to cover the time of that extraction, because it is a little bit of a tedious process. If we do have a really bad infection, covering antibiotics, God forbid there's any sort of post-operative complication and the site opens up and then you have to repeat, we're going from a couple $100 to now a couple $1,000. So two things there. I know that's big sticker shock for most, but pet insurance and getting pet insurance early, especially if you're thinking about getting a smaller breed dog or a brachycephalic dog, like a French bulldog or something like that has more of a chance of crowding, Yorkshire Terriers, Maltese, different of poodles, that sort of thing. Getting pet insurance when they're young, most premiums don't necessarily cover just a dental cleaning, but almost all the procedures do cover when there is an issue. So all of that extra expense that goes with needing extractions and, gingival flaps and antibiotics and pain meds and all that good stuff, that would be covered. So we have had many clients that have been able to skirt, several $1,000s worth of dental cleaning or dental work for their pet just by having a pet insurance policy. So definitely something, if you have a younger dog that doesn't have any pre-existing conditions, look into it for sure.
Wow. So I didn't know that. Pet insurance covers dental cleaning?
Most don't cover the actual cleaning itself. It's because it's considered like a vaccine, or it's more wellness and preventative care, but it will cover if there is an infected tooth, if there's a fractured tooth, if there is a resorptive lesion in a cat, that's an actual medical problem. It will cover the additional costs of that portion. But that being said, you have to get your policy in place and have everything set up before a veterinarian ever says that your dog has periodontal disease, because that will be considered a pre-existing condition. So, definitely read through the fine print, ask the right questions. But there was, I forget which veterinary dentist it was, but it was a funny little clip that said the only animal that doesn't suffer from some degree of periodontal disease is an animal with no teeth. So it's not, despite everybody's best efforts, it's going to happen. So, being prepared for it, and especially being prepared for it financially. So like you said, being the rock in the hard place, at least you can take some of that financial burden off. And then, that's just one aspect of that being covered. If they have some sort of ACL or orthopedic injury, or, develop pancreatitis, or, is chewing on that rawhide, that's helping with their teeth, but accidentally swallow a big chunk of it, then you will have your pet insurance in line, and it will help you. So I know that's a little bit of a tangent, but while we're on the topic of very expensive things that are not going to be getting any cheaper anytime soon, that would be my best recommendation.
Got it. That was an awesome tangent. But so I, you were talking about a dog with no teeth. Does teeth removal even actually cure periodontal disease? Like, is the disease gone now that the teeth have been removed, or do they still suffer from symptoms?
It depends on, so if you have a cat, so cats are the most common one that we see with this. They develop a condition known as stomatitis, which is an immune condition, and the body just literally wants to get rid of all the teeth. And so they have horrible inflammation. They get terrible infections. It's just a really nasty condition. So the only treatment for it is to take everything out. And those cats do phenomenal. They do great. And that does completely resolve the problem.
Wow.
If everything's done right and there are no remaining roots, those animals no longer suffer for periodontal disease. Most of the time, if we have an animal that has a tooth that is, one isolated tooth, it typically has caused damage to the teeth around it. So even if we take that one, if there's not enough reason to remove the tooth around it, we're kicking the can down the road, more than likely that additional tooth will develop periodontal disease down the line.
Even if you
so
brush
it kind of depends. Even if you brush it, sometimes the damage to the bone has already been done.
Wow.
Maybe not to the extent of warranting taking the entire tooth, but it will certainly be more prone to developing it down the line.
Got it. Okay. And so you kind of already answered the question, but I'm going to ask it anyways. You said that pretty much as long as the other teeth haven't been affected, then yes, it can cure periodontal disease. But if the damage has already been done to the other teeth, and you're just you can't justify still removing it because it doesn't look as bad, I guess. It doesn't. But so on that point, and let's say you have a dog that has no more teeth. Can this dog live a normal life without teeth? I mean, I'm sure you've seen that to where they just live a normal life. Is that possible?
Oh, for sure. I mean, we have, I can count a handful of small dogs that, their dental health, one, they were just born to have teeth issues. And then it was kind of put on the wayside. And then by the time we finally got to it, every single tooth was affected and infected and had a reason to be extracted. And so we have these little toothless ankle biters that are just happy as can be, have, funny little smiles. And they, even some of them where they wouldn't eat dry food before now eat dry food now that they have no teeth. And how that science happens, I don't know.
How does that work? I was just going to ask.
They're just like dolphins. They just swallow it straight down, or, they'll just kind of mush it up a little bit. But, or they just eat wet food and they are as happy as can be. So, so certainly, that is one of the questions I always get, when I survey a mouth, they take all the x-rays, I identify all of the issues and say, okay, these are the teeth that need to go, and call the owner and say, okay, well, we need to take, 6 teeth today, and it's going to do they're doing them no favors. They're going to be more comfortable with them out than in once we get through the healing process. And they say, oh my God, but he's not going to be able to eat. He's not going to have enough teeth. It's like, honestly, we can take them all and they can still live a really happy life. So, so that's something I always try and placate. It's not the end of the world, and it's certainly a better alternative than leaving a tooth that may be a little bit more functional in chewing, but is painful and infected and causing issues elsewhere in the body.
Got it. Well, that was a lot of information today, and I'm really thankful that we were able to have you on. I hope for our audience, at least I know for sure that this was helpful for me. So that's going to do it for us here at the Theory of Pets podcast. Thank you all for joining us. Why don't you, Dr. Kingsley, why don't you tell everyone, I know we've talked about it before, but at the end of every podcast, I ask where we can find you and where we can find or learn more about Better Vet.
Yeah, so Better Vet, we are nationwide. We do offer the services that I've mentioned today. So I know one piece of feedback I get when offering a dental is or a sedated procedure is like, oh, well, I don't want to leave my pet at the hospital all day. They hate being in the hospital. I just can't bear to think of them sitting in a kennel and all this unfamiliar things. But I can actually offer these procedures where we come to you. We can do the cleaning. We can take full mouth X-rays. Once they're recovered and awake and have their sea legs and all their vitals are stable, they can go right back inside to their dog bed where they're comfortable and not have to hang out in a clinic all day. So if that sounds like something that would be a better fit for you, you can find us at bettervet.com, also on Instagram at bettervet. I am based here in Austin, Texas, where we do provide those services. But again, we're in many cities nationwide. So certainly have a look-see, and hopefully if you've never tried house calls, it would be at least worth trying. It's a lot less stressful for most of our patients.
And I think I touched on it earlier at the beginning of the podcast, but you guys just opened or just, I guess, found new veterinarians that act under Better Vet in the cities of New York and LA. Is that correct?
That is correct. Yep. We have a very robust team, both in LA and kind of the surrounding areas. I know LA is kind of a very general term. But we have an awesome new team, and they actually have 4 of the mobile units that I had mentioned before that are just state of the art, have all the most recent bells and whistles, and they do a ton of dental procedures themselves.
Awesome. Fantastic.
Yeah.
Well, thanks again for coming on, Dr. Kingsley. And those to you listening, thanks for joining us today. And with that, I hope you have a great day, and we'll talk to you soon.